Dressler syndrome. Dressler syndrome is historically a phenomenon complicating about 7% of myocardial infarction. So it is the complication after myocardial infarction or even the after percutaneous coronary intervention, and this disease usually occurs with low-grade fever, chest pain, and that is a pleuritic chest pain, and pericarditis, pericardial friction rub, and chest pain worsening when the patient is lying down in the recumbent position, and there will be an ST elevation. And if you are taking the Dressler syndrome, is a form of pericarditis or inflammation of the pericardium, and a tough elastic sac that surrounds the heart. This may happen when the immune system reacts after some type of damage to the heart. What is Dressler syndrome? So Dressler syndrome is a type of pericarditis, and there will be an inflammation of the sac around the heart, that is pericardium, and even if we can call it as post-pericarditis syndrome, post-myocardial infarction syndrome, or post-cardiac syndrome. So here what will happen, the pericardium become inflamed and it can rub against the heart and can cause chest pain, and even excess fluid may occur, and this fluid may build up between the pericardium, that is between two layers, and this will be causing some pressure in the heart. And this typically occurs after heart surgery or any myocardial infarction or any cardiac injury. And Dressler syndrome is thought to occur when the immune system responds excessively following any events, that is mainly after heart attack or after heart surgery or even a cardiac procedure or any chest trauma. And what causes Dressler syndrome? So the Dressler syndrome is the exact cause is not clear, and it is believed that it mainly occurs after the occurrence of heart attack or any myocardial injury, and it will cause a typically sense immune cells and antibodies to help repair the area. But here, if the immune response can sometimes cause an excessive amount of inflammation. Even some of the events that trigger the Dressler syndrome include any heart surgery or any cardiac procedure or chest trauma, and even the patient, those who are taking prednisolone previously, or any implantation of a pacemaker, or even a cardiac ablation, pulmonary vein isolation, or any penetrating trauma to the chest, and even the viral infection. So what are the risk factors of Dressler syndrome? So it is higher in the people those who have had a heart attack, and even other risk factors of the patient being a younger age, having viral infections or history of pericarditis. And the patient those who are treated with the prednisolone earlier, or any surgeries, mainly valve replacement surgery, or the patient those are having B negative blood group, even they are using any Holotherm anesthesia. And come to the pathophysiology, due to the moderate or large pericardial effusion, there will be occurrence of cardiac tamponade or suspicion of infection. So if there is any suspicion of infection, we should try, if there will be a drain of effusion, and if there is no infection, there will be a large effusion that will be about 20 mm will occur, and if it's not present, we have to treat pericarditis. And if large effusion present for less than a month, or the patient may have a right-sided lung collapse, heart collapse, right side heart failure, the patient will be having right side heart failure. And if the right side heart failure is not present, we can treat the pericarditis, and if there is a presence of right side heart failure, we can treat the heart failure, and we should also try effusion. What are the symptoms of Dressler syndrome? So mainly the symptom will be occur from 2 to 5 weeks after the initial event, and even some people will be asymptomatic till 3 months, And the main symptoms of the patient will be complaining of having chest pain. That will be worsened at the time of lying down, and even it will be worsened at the time of deep breathing or coughing, because it is a pleuritic pain, and there will be a fever, difficulty or labored breathing, fatigue, and the patient feel of weakness, decreased appetite. How we will diagnose the Dressler syndrome? So the Dressler syndrome is difficult to diagnose because the symptoms are similar to other conditions like heart failure or cardiac tamponade. So the doctors will be feel if the patient is ill for 2 to 3 weeks after the heart attack, they want to conduct some tests to rule out the Dressler syndrome. So usually the blood test will be done, the complete blood count and blood culture to rule out an infection, and even other blood tests to look for elevated C-reactive protein levels or elevated erythrocyte sedimentation rate, and both of which should mean that the patient may have inflammation. And blood culture to rule out infections, and echocardiogram. The test can detect the presence or absence of fluid around the heart, in the pericardium, the lining around the heart muscle, and how much fluid, if it any potential adverse impact this fluid may be having the heart muscle. What is Dressler syndrome? So Dressler syndrome is a type of pericarditis, and there will be an inflammation of the sac around the heart, that is pericardium, and even if we can call it as post-pericarditis syndrome, post-myocardial infarction syndrome, or post-cardiac syndrome. So here what will happen, the pericardium become inflamed and it can rub against the heart and can cause chest pain, and even excess fluid may occur. What are the complications of Dressler syndrome? The immune response that causes Dressler syndrome may cause a condition known as pleural effusion. So that is the fluid accumulation in the pleural sac. You can see in the diagram, this occurrence of fluid, that is the pleural effusion. And in rare cases, there will be chronic inflammation in the heart, can be very serious complications. So here the fluid will be built up in the sac, and it will be causing excess pressure in the heart, and what will happen, that the patient will go for, it will be very difficult to pump. So as a result, the patient will go for cardiac failure. So as a result, there will be it will lead to shock and even death. And the chronic inflammation in the heart can also lead to constrictive pericarditis. So here what will happen, the pericardium become thick and scarred due to long-term inflammation. So what are the risk factors of Dressler syndrome? So it is higher in the people those who had a heart attack, and even other risk factors of the patient being a younger age, having viral infections, or history of pericarditis. Treating complications. So the complications, so more aggressive treatment may be needed, and the pleural effusion is treated by draining the fluid from the lungs with a needle, and the procedure is called thoracosynthesis. And the main complications and the rare complications are cardiac tamponade and constrictive pericarditis. And cardiac tamponade, that is excess fluid build up in the pericardium. So what will happen? It will put pressure in the heart, and severe compression of the heart interferes with the ability to function, and as a result there will be a drop in blood pressure, and this issue can be fatal without treatment. So better we can go for pericardiocentesis. So here a needle or catheter is used to remove excess fluid. And for constrictive pericarditis, that is hardening or thickening of the pericardium, causes impaired heart function. So the heart become compressed, which can cause blood to back up in the lungs. So the constrictive pericarditis can be treated with surgery to remove the pericardium, that is pericardectomy. Thank you.